Hi, it's Victoria Field, co-host of Metabolic Health Summit, and we've got a very special guest live today on Facebook. I'm very excited to bring this guest on. She's a physician, she's an author, she's an international speaker, and she's going to be coming to Metabolic Health Summit 2020 this upcoming January. And her name is Dr. Mary Newport. Now, Dr. Mary Newport, she has practiced neonatology, which is the care of sick and premature newborns, for 30 years in Florida. She's also the founding medical director of 2 newborn intensive care units in the Tampa Bay area. She's an author of 3 books, one of which just recently came out called The Complete Book of Ketones. And she speaks around the world on ketones as an alternative fuel source for the brain. So in 2008, Dr. Newport discovered a nutritional intervention that could actually provide ketones as an alternative fuel source for the brain for her husband, Steve Newport, who had been diagnosed with early onset Alzheimer's disease. And Steve actually responded dramatically well to MCTs, or medium chain triglycerides, from coconut oil, and went on again later to improve when he was a part of a pilot study involving ketone esters. And I think Dr. Newport is actually in the room, and she's going to dive into that story in a little more detail and talk to us about what she's going to be sharing about the important topic of Alzheimer's disease, as well as other disorders, and the potential and power of ketones. So I'm so excited to invite her in. Let's see if we can add her in here. Let's see, Facebook. All right. I just sent you a, let's see. I see you. I think you're there.
I think I'm there. Just trying to get my camera oriented perfectly. Okay.
How are you?
I'm really good. How are you?
I'm great, thanks. Facebook is our friend today. We've got no headphones. We're all good. We're ready to rock.
Great. Fantastic.
Well, we're so thrilled to have you as a speaker at Metabolic Health Summit 2020. You've really just done such incredible work as you know, a champion for so many people, and have such a passion for educating the public around ketones and their potential with Alzheimer's, as well as a variety of other disorders. I mean, you've written 3 books, you're traveling around the world. I know we just talked about all the places that you've been spreading the word about this important message. And so I want to introduce people who might not have heard of your work about how this all started for you, because it came from really a difficult place and has turned into something that you've really carried on Steve's legacy through your work now in the present time. So if you want to talk a little bit about how that started for you.
Okay. So my husband Steve had early onset Alzheimer's disease and began having symptoms when he was 51, and he was diagnosed at 54. And then at age 58, which was in 2008, he was actually going downhill very fast. And there were a couple of clinical trials that became available in our area. So we were trying to get him into those. And I was looking for risks and benefits of these 2 drugs. And I came upon a medical food that was in development. It was about a year away from being recognized by the FDA. And it claimed to improve the memory and cognition of nearly half the people with Alzheimer's that took it. And you don't ever hear that about Alzheimer's drugs. None of them claim to improve memory or cognition. So I found their patent application. I learned it was MCT oil, which I think a lot of your listeners will know what that is now. Back then, almost nobody knew what MCT oil was in 2008. But they had done studies, and the reason that could help somebody with Alzheimer's is because there's a problem of glucose uptake in the brain, in particular areas of the brain. It's very much like type 2 diabetes. In fact, some people call it type 3 diabetes because it affects the brain. So ketones are an alternative fuel for the brain, and we actually know now that ketone uptake is normal in the Alzheimer brain in the same areas that have poor glucose uptake. So when you eat MCT oil, part of it is converted to ketones, and it doesn't matter what you eat. Part of that oil will be converted to ketones and potentially provide fuel for the brain. So this worked brilliantly for him. I found he happened to be screening for 2 clinical trials. So we had a day before and a day after, and I learned that it was extracted from coconut oil, which is the richest natural source. About 60% of the fats in coconut oil are medium chains. And
Right.
so anyway, he had a very dramatic response. He had an improvement on memory testing from one day to the next before and after taking it, and
Wow.
clock drawing. He drew the first, after he did not do well with that first testing for clinical trial. He drew a clock that was just a few random circles and numbers, very disorganized. And the doctor told me he was on the verge of severe Alzheimer's. And I thought, okay, I've got to see if this helps, and figured out how much coconut oil to give him to equal the MCTs that were in the medical food. Basically that's what I was going on. And 2 weeks later, his clock was so much improved. He drew a full circle. He drew all the numbers in. He had like dozens of hands of the clock, but it was
Wow.
much more organized, and so many other things happened. He just became much more alert. He could find utensils out of the kitchen drawer and, get water. Conversation improved dramatically. He started whistling and telling jokes
Wow.
again, and just so much more like my husband of several years earlier. And so it was just kind of very dramatic. And so then I just felt
Wow.
like I had to start telling other people, why should they have to wait for this medical food to come out, a year later, and however many years it took for doctors to pick up on it and start prescribing it. So,
Right. I mean, that's something that we can all get on Amazon these days or
right.
anywhere
Yes.
at this point.
Yeah.
And the fact that you're now sharing this information is huge. What was that like for you as, a physician yourself, finding something like coconut
Mhm.
oil to have such a profound effect? What was
Yeah.
that like for you
Well,
when there's all these drugs out there, right? But we
right.
find this one thing.
Yeah, it
It's new
was
to
it
you.
was quite surprising. And the reason I knew what MCT oil even was is because I'm a neonatologist. I did newborn intensive care for 30 years, and we used to add it directly to the feedings of our tiniest preemies to help them. They absorbed it well, they would gain weight faster. So I actually knew what it was. And I really think if I
Oh,
was in any other specialty, there's a good chance I wouldn't have known what it was, much less, what to do with it.
wow.
And so, it just, to me, it was just a complete fluke, an accident, that I found it. But, in medical school, we had very little on nutrition, but they would call coconut oil the artery clogging fat. That's what we were taught.
Right.
Very little about it, but that's all they taught us. And so I always wondered why it was in health food stores. And,
Right.
so then, when Steve responded so dramatically, even just the first day, he had improved scores on testing and he got into a clinical trial. I didn't know if it was just really good luck, but I just delved into learning everything I could about coconut oil, and I found out all kinds of interesting things about it. That, the lauric acid, half of coconut oil, is antimicrobial. It kills all kinds of microorganisms, viruses and
Right.
bacteria. It kills the bacteria that cause dental cavities. So you're starting to see coconut oil now in toothpaste. It kills the
Oh, and
acne
everything,
bacteria.
right?
I mean, it just kills so many. And there are hundreds of studies of microorganisms that may trigger or accelerate Alzheimer's. They just haven't gotten any prominence, this particular area of research. And it's much like ketone research. This was going on in the
Right.
background, really, since the 1990s. Dr. Richard Veach was hypothesizing that this would help people with Alzheimer's and developing a ketone ester back in the mid 1990s. And here we
Yeah.
were years later, and nobody, knew anything about this idea of ketones for Alzheimer's. So,
Right. It's pretty crazy. And then
yeah,
Steve was a part of a one-person pilot study
yes.
using ketone esters, right?
Right, right. So 2 years after we started the coconut oil, he had a setback. I'll probably talk about it more at the conference, what happened. But Dr. Veach they had finished toxicity testing, got recognized as GRAS, generally recognized as safe by the FDA. But he could only make enough for one person in his lab. He had been trying to get funding from the NIH, and he said, "Why don't we make Steve a pilot study of one person, and I'll send you, the raw material, and you figure out how to give it to him." And to
Jeez.
tell you the truth, the raw material tasted pretty bad. It was,
Oh,
you
it's
know,
jet fuel
yeah, they
as
talk about
one
jet
of my
fuel,
co-hosts.
furniture polish, whatever obnoxious substance you can think of. And so then, I had to try to figure out, I tried everything I could think of to try to make it tasty, but
Yeah,
he,
that's wow. I would love to hear those stories
yes,
because I don't know how you cover the taste of
yeah,
that.
yeah, it was interesting, but we figured it out, but he would still shudder every time he took it. But he was a willing
Yeah.
participant. The thing about Steve was he knew that he had this problem. He knew he had Alzheimer's. He knew what he had
Wow.
been able to do and what he could no longer do. It was so, so frustrating for him. So he was a very willing person. He was willing to do whatever I told him to do to try to fight this disease.
Wow.
And he was so excited, the day that that showed up on our doorstep. And,
Wow.
really,
Yeah, and it
mm,
provided you guys with some quality time together that
yes,
maybe wouldn't have been there otherwise.
right.
Is that something that you really
Yeah,
believe?
definitely. Just the coconut oil, within the first 5 days, it was obvious that things had gotten better. And, he continued to improve over a year. And I would say between that and then the ketone ester, we probably had about 3.5 to 4 years that were better than the year before we started the coconut oil. So it bumped his quality of life up quite dramatically. I felt like I had my husband back. I was kind of the evil stepmother that made him take medications. And, before that,
But it
and
helped,
yeah,
right?
it helped tremendously. Our relationship too was, it was different. It was back to being husband and wife again. And it was just,
Yeah.
super wonderful. And, my only regret was that we didn't find it sooner, that we hadn't learned about it sooner. And it was kind of buried. The first clinical trial for MCT oil was a 20-person pilot study, and it was published in 2004, which was right the same year he was diagnosed. And
Wow.
but it was buried in a very esoteric journal, research journal that most people would never, most physicians would never come across it.
Wow.
Yeah.
And with the fact that you work in neonatology,
Hmm.
what you've done for, 30 years,
Hmm.
understanding MCTs,
Hmm.
really, that's so interesting that it actually helped you sort of make that connection. And
Yeah.
what's so fascinating, and a lot of people don't realize, and I know you're very familiar with, is that newborns are actually born in a state of
Yes.
ketosis. And MCTs are a part of their life,
Yes.
when it comes to breastfeeding. And
Yes.
so I mean, it's really a fascinating thing. I'm sure in your education around it, you really discuss these
Hmm.
things, and I know you're going to take a real deep dive into it at
Hmm.
Metabolic Health Summit.
Yeah.
Let's talk a little bit
Okay.
about those topics,
Hmm.
because one of them you're going to go into more depth around this story with Steve
Hmm.
and sort of your work with Alzheimer's research,
Right.
but you're also going to be talking about some of the do's and don'ts with the ketogenic diet for
Right.
physicians,
Right.
which I'm really excited
Hmm.
about. From a physician's perspective, explain what you're most looking forward to in these talks, especially when it comes to education
Yeah.
around something like a nutritional intervention that's not currently used as
Hmm.
standard of care.
Right. So, the keto diet has become extremely popular along with ketogenic exogenous ketone supplements, ketone salts, ketone esters
Mm.
just came on the market about a year and a half ago. The salts have been there for about 3 years, and there are other, technologies like that coming along. But, it's out to the general public, and most physicians have not ever heard of this. Um,
Mhm.
but a
Right.
lot of people with chronic conditions, when you think, when you get to people in their 50s and 60s, many have diabetes, pre-diabetes. There's a big problem with obesity in the country. It's, people have been eating way too much sugar for way too long. And then, dementia, Alzheimer's is a growing problem, and all these chronic diseases that go along with diabetes. So there are effects from ketone supplements, for example, the salts or the esters. They tend to lower your blood sugar. So, and quite dramatically. When I have checked this on myself quite a few times, and with my husband too, when he was taking the ketone ester, and I see like a 15 to 20 milligram per deciliter drop in my blood sugar within an hour after I take it, and it lasts for hours. So actually, this could be very beneficial for people with diabetes, but they also need to
Yeah.
know about it, because if they're taking insulin or they're taking a glucose lowering medication, that could be a problem if they're not aware and they're not monitoring closely. They might
Absolutely.
actually need to drop their medication, but that's something they need to be monitored closely for and discuss with their physician. So things like that. Electrolytes in the ketone salts, there are, sodium, potassium, calcium, magnesium salts, and these could affect the balance, in the body. If somebody's taking a diuretic, they're losing a lot of sodium and possibly potassium, depending on which one they're taking. A lot of people take potassium supplements, so they can't just throw something like that. Well, they can try, but it could really affect the balance of their electrolytes if they start to take ketone salts and they really have no idea that they may have this potential side effect. Some people get dehydrated too when they're taking them in the beginning because they're not drinking enough fluid. So there are different effects like that, that I really want to educate about. And I want I want every physician on earth to know about the benefits of ketosis and how we can help our patients achieve it, but also be aware of the potential side effects, these changes in metabolism that can occur, so that they can help deal with it, know it up front, monitor patients closely that come to them, wanting this help. And, so, that's kind of where I am with that. I just think there just needs to be a huge amount of education, and Metabolic Health Summit is a great way, for physicians to get educated in this whole new area that many of them may not be familiar with.
Yeah, no, thank you for that. That's why we were so excited to be able to offer continuing medical education with a joint partnership with Cedars-Sinai to really make it happen for the medical community as well as dietitians, because it's all about education right now. And it's not just a fad diet. A lot of people are using it for a variety of things, but it really has the potential in so many different areas. We're going to be covering everything from Alzheimer's to cancer to, autism. There's a variety of things right now. The research is just fascinating, and you're a big part of pushing this whole movement forward. And it's, part of it's quite grassroots, but it's also deeply rooted in science as well. So I commend you for all the work that you do. Your passion for this is evident and inspiring. So
thank you.
Thank you for everything you do to get the message out. I know you were just telling me you've been in Mexico, you've been Australia, all over talking about this.
I just got back from the Philippines a few weeks ago. I just got back from Germany last weekend. And it's been amazing because it's not just a fad here in the US. There's a growing interest around the world. When I was in the Philippines, for example, there were several older people, they were participating, but they're really into overnight fasting. That's a trend, that they're doing overnight fasting, intermittent fasting, which can help increase ketones. And I was just surprised. I was there a year ago, and this year they were all talking about this. And, this idea is getting out all around the world. And, there's just so many variations really of the ketogenic diet. People think of it, and doctors think of it as the strictest form, the weighing, the measuring, the ketogenic diet for epilepsy. If they know about it at all, that's the diet they're familiar with. And they often will say it's unpalatable. Well, there has been a lot of work done by a lot of people to make it palatable. So many websites. And, last year I was just amazed at the exhibits, how many companies have developed keto foods, that people can incorporate into their diet to make it a lot more fun, more interesting than it used to be. And, people can achieve a lot with mild nutritional ketosis. They don't need to necessarily go to the strictest form of the diet unless perhaps they're dealing with cancer or epilepsy that's not responding to medications. But there are many more benefits, and mild nutritional ketosis may be more appropriate for some people and more doable. I think of the elderly population with Alzheimer's. There are several studies going on now of ketogenic diet, with and without MCT oil. When they have MCT oil, they can eat a lot, considerably more carbohydrate than if they don't include MCT oil in the diet, for example. But, I do worry about the long term, trying to do a very strict ketogenic diet in someone who's not used to this and is quite elderly and has Alzheimer's. It would be quite a challenge, I think, to keep it going for the long haul. So perhaps, striving for, mild nutritional ketosis and using MCT and coconut oil to help make that happen, might be an easier way to go.
Yeah, I was going to mention that, like easing people into it and starting, even just, if you have an elderly person that maybe can't do a complete diet switch, just adding that in might make a significant difference for some people. So it's just these baby steps and truly understanding the diet as a whole, and it doesn't have to be extremely restrictive. Yeah, if you're using it therapeutically, but like you mentioned, even a mild state of ketosis, many people say they experience improved cognitive benefits. I know that's why I follow the diet, is because I can think more clearly.
Right.
It's funny, back in the day when I used to be on TV news, when I didn't eat before I went on the air, I couldn't think straight when I was, big into carbohydrates. Now I think better when I don't eat. Yeah. So, it can really provide benefits to a wide variety of people. And it's just exciting to see where the research is going and what is next for you. I mean, you've got 3 books out that are phenomenal. If you've not checked them out, you can find them on Amazon and also your website, which is coconut ketones
with an s.com.
Yes.
I have a lot of information. I have a page, Keto Diet Start Here, for people that are mainly interested in that. I have another page that's called Alzheimer's and Dementia. So this is for people with Alzheimer's, Parkinson's, other types of dementia, other neurological disorders that have, resources, for them to look at, but also information that I've written about how to use ketone salts, like combining, using ketone salts in the elderly and people with medical conditions. I have ketone esters, what, why, and how. And I wrote it so that people can understand it themselves, but they can also take it to their physician and it will teach the physician what they need to monitor. So, I have that kind of thing on my website. I have videos that people can watch and, I want to write. I have at least 3 more books. I want to write. So
we're all excited.
Yeah, I mean, there's just such a strong connection between diabetes and dementia, and the ketogenic approach can help both. There are a couple case reports that came out this year. And they were people that had mild Alzheimer's and also had insulin resistance. One had diabetes, one had metabolic syndrome. And it was amazing how much they improved in just 10 weeks of a ketogenic diet. And they were aiming for ketone levels greater than 0.5 millimoles. The author told me,
baseline ketosis.
Yeah, that's mild. And these people had all of their numbers related to type 2 diabetes, the hemoglobin A1C and insulin levels came down dramatically, and their scores. There was a man, his score improved from 23 out of 30 points on memory testing. It increased from 23 to 29 out of 30. And a woman over 10 weeks, her score increased from 21 to 28 out of 30. I mean, that's dramatic. That is big. It's a relatively simple memory test, and they both had been diagnosed with mild Alzheimer's. And then they, their scores were normal or very close to normal. And after 10 weeks on the diet, I mean, that's the power of this approach.
Unbelievable. Right, especially when you compare that to the current drugs that are out there, as you were mentioning before, and you don't see things improving. You don't see this reversal of Alzheimer's. And it's not really a thing. So it's pretty incredible, some of the information that Dr. Dale Bredesen talked a little bit about last year as well. I know you were there at the book signing right there with him, and we're just so excited to have you come out and speak personally about your experience, the research that's currently going on, and the future of this really too. I mean, for you personally, where do you want to see the future of metabolic therapies for both Alzheimer's and other disorders? What would you like to see happen in the future? What's your goal at the end of the road?
Really that everybody knows about it, so that they at least have the opportunity to decide for themselves, do they want to take this approach or not? that's how I was, really beginning in 2008. I started writing and writing and writing, and to politicians, to people in Alzheimer's research, everybody I could think of, to try to get them to pay attention to it. And I remember having a conversation with someone high up in the Alzheimer's Association conference. This is food. It's nutrition. It's not a toxic, potentially toxic medication. And why shouldn't people at least know about it so that they can decide for themselves if they want to do this or not? And the same thing, with the researchers. I had trouble. They actually approved and then unapproved allowing me to have a table at the Alzheimer's Association conference after this happened with Steve. Just his case report and imploring researchers to study this, was basically the article that I wrote, and they wouldn't allow me to do it. And I argued with them, it's just food that we're talking about,
Right.
But finally, 8 years later, in 2017, they've had the first ever session on ketones. Dr. Stephen Cunnane presented his very interesting work with ketone and glucose PET scans, and there were 3 other physicians that presented studies that they were doing with the ketogenic diet and or MCT oil with Alzheimer's. So it finally is getting recognized, that many years later, but at least it is now. So, I just
thank you for your work in keeping it going forward. It takes a lot of work, especially when you're sort of, searching in the dark almost, when it wasn't really readily available or really known about, and how to implement it, especially with ketone esters. I can't believe your story with going through that process and trying to understand that. And make it palatable and all of those things when there were no resources. So it takes a lot of courage to be able to do something like that when, the only information that is out there is based around epilepsy. But I feel like it's growing so quickly right now. The research is expanding. It's up to, us, Metabolic Health Summit. And I know you do a phenomenal job of it in educating, keeping that education going. As keto becomes this buzzword, it's so important to keep science at the forefront of what we're all talking about.
Exactly.
And you do a great job of that.
Thank you.
So thank you for all your work. We're so excited to have you come out to Metabolic Health Summit.
I can't wait.
It's going to be a lot of fun. Dr. Newport is going to be speaking both in our neurological symposium, all about the sort of her experience with Alzheimer's and her husband, as well as the current sort of research, and just covering all topics, brain metabolism, things like that. And then also hosting a special interest forum that's specifically for physicians. So if you're a doctor watching this, you really want to understand the do's and don'ts of the ketogenic diet, which is something that's not really taught right now to doctors. You really have an incredible opportunity to learn from Dr. Newport here, and she'll be there all weekend and at our book signing, I'm sure, as well. Again, so we're thrilled.
I'm excited about that.
It was a lot of fun last year.
So it was.
Thank you for anything you would like to say to those who are watching. We've got a variety of people here, including some past attendees, people from Brazil, all over the world.
Oh my gosh.
Anything else you'd like to add?
Well, it's just, this is the 4th year, right, for this conference. 2 years we're in Tampa.
Yes.
And then there was a little break there, and now this will be the 2nd year out in Long Beach. And it's very broad. It covers a lot of different areas, of how ketogenic diets and these nutritional therapies can help people. And, I feel it's really geared towards everyone. I think everyone can really understand this and get a lot out of it. And really benefit from it, and then take it back to the people they know and share the information. So I encourage really everyone who has an interest in it, whether you're part of the general public, a non-scientist, a citizen scientist. I have a friend, she had no interest in science, so her husband got Alzheimer's, and she's a citizen scientist. And then researchers and physicians and dietitians. I think dietitians too. Because I'm sure people are asking them about the ketogenic diet, and this is a great opportunity to learn as much as possible for everyone.
Oh, thank you. Yeah, I know we really try to bridge that gap between the science and the real world because that's how we move this thing forward. I mean, it's so important to support the research, but it's also important to do exactly what you're doing and
Mhm.
educating the public really around the world, because that's how we can move metabolic therapies forward. So thank you, Dr.
Oh, you
Newport,
are
for
very welcome.
joining me today.
You're very
Excited to
welcome.
see you in
Yeah.
January. And for everybody watching, if you want to learn a little bit more about Metabolic Health Summit, you can go to
Mhm.
metabolichealthsummit.com. We still have early bird tickets through October, but they will probably sell out. So make sure you get them soon. And we will be seeing you very soon.
Yes.
Share this Facebook Live. And Dr. Newport also has some great content herself that you put out live videos all the time. And
Right.
great content. You've got a great website. Anything you want to say about that before we go?
Yeah. Well, my book, it's called The Complete Book of
Yes.
Ketones, A Practical Guide to Ketogenic Diets and Ketone Supplements. And I interviewed 16 different researchers. I wanted people to understand this is serious research. This has been going on for 100 years, almost, since the ketogenic diet was first used for epilepsy. And I interviewed the oldest researchers. So the oldest is Dr. Theodore Van Italy, who's turning 100 this fall, still writing about ketones. He wrote the foreword for my book, but he and his partner, Dr. Sammy Hashem, who's in the book, it was 88. They figured out that
Wow.
MCTs are converted to ketones back in the 1960s.
Oh,
Yeah, and then
oh,
Dr. Cunane, of course, Dr. Dominic D'Agostino and Angela Poff, Dr. Poff, are in the book. Dr. Tom Seyfried, just a whole, the old people, Dr. Richard Veach, and the upcoming, rising stars of ketone research. Just and also, I interviewed some people, a man with Alzheimer's and his wife
wow.
about their experience, which has been really quite dramatic, trying all these various, ketogenic approaches, and then a man with Parkinson's who's had quite a profound and long, extended improvement related to this. So, and
Wow.
then, just all the nuts and bolts of the diet and a whole lot of information in there. So you can find,
Wow.
a little bit about my book and my other books on there, and articles. A lot of the scientific articles, full-length articles, are available for people to look at, like works by Dr. Richard Veach and I believe Dr. D'Agostino and Poff, and Tom Seyfried, articles by these people so they can see this is serious science. Mhm.
Absolutely. Yeah, that's like you said, it's been around for nearly 100
Yeah.
years. And it's exciting that people are really starting to understand
Mhm.
that there's a lot there. And we've got a lot of exciting times ahead in the future with this. And that's why we're so passionate about spreading
Yeah.
the word about metabolic therapy. So thank you for all you do.
Oh,
And
you're
you
welcome.
can find Dr. Newport,
Mhm.
coconutketones.com.
Right.
Great resource. Her books are on Amazon. And we will be seeing you in
Mhm.
January at Metabolic Health Summit 2020.
Yeah. Thank you so much
Thank
for
you.
having me on this live Facebook.
Well, thank you
Victoria,
for joining us.
nice to see
Yeah,
you.
thank you for joining me. We'll see you soon. Thank you everybody for watching. All right, bye, Dr. Newport.
Bye.